Hey guys, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And today I wanted to talk a little bit about stride length in runners and initial contact. So for those of you who don't know, initial contact is when that leg comes through at the end of a swing phase and hits the ground. So in different people, sometimes people will hit in the forefoot, which is towards the front of the foot, and others will hit the initial contact more on the heel, and then anywhere in between there. Hey Jen, nice of you to join me. Talking a little bit about runners, obviously, as I talk about this almost every single day. And if there is a correct place for heel strike or for initial contact with running. Because what you hear is that typically people who don't have a lot of experience in treating runners, something that you might see if you go to these running stores that are doing gait analysis, it seems a lot like they're forcing people into these forefoot strike patterns, which are not necessarily always going to be proper, the right initial contact point for everyone, right? So there are Olympic level athletes who are striking in the forefoot. There are Olympic level athletes that are striking in the hind foot, at the heel, at the same distances. It's just everybody's a little bit different because of the way that we're built, the way that we train. So forcing someone into a certain initial point of contact doesn't make sense clinically. But I wanted to talk briefly about what happens when you change the stride length, and therefore decreasing or changing the cadence. If you don't know, cadence is step rate. So typically what you hear is, and this makes sense, is that when you increase the stride length, you are decreasing the cadence. And when you decrease the cadence, you're increasing stride length. Okay, naturally that just makes sense. So this is, and that's at all the same speed, by the way. So what we know with an increased stride length is that the initial contact of the foot is going to be closer to the heel and to the structures closer to the rear foot. So this increases the force on the tibia, and the force is going through the knee as well as the IT band. So does everyone that has more of a posterior foot strike have problems with these structures? No. What we do know, though, is that if someone is having trouble with these structures of the anterior leg, that if we increase their cadence, it changes the spot where all of the forces are going through and allows those structures to heal. So hopefully that makes sense. On the other end of the coin, by decreasing your stride length and increasing your cadence at the same speed, your initial contact will be closer to the forefoot. Hi, Toby. Thanks for joining. Which relies more heavily on the structures of the posterior calf complex, which makes sense is as your initial contact is coming towards the toes, obviously you're going to have a little bit more reliance on the calf. So try that out a little bit. If change your cadence and see if you notice any difference, because like I mentioned, as you decrease your cadence, you'll notice that your stride length will get longer. Okay, so if anyone tries to tell you that you need to increase your cadence, regardless of understanding where you're having pain, you need to question that. Okay, if you're having calf pain and someone has you increase your cadence, that doesn't really make a lot of sense, because having problems with the calf would indicate that increasing the strain through the calf with each step would lead to poor healing, right? If you're trying to rest that muscle group. So what I would suggest would be to actually slow down your cadence if you're having trouble with the calf. Okay, so I know I'm kind of throwing around a lot of these terms and it can get a little bit confusing, but in general, if you're having knee pain, IT band pain, pain in the tibia, or potentially healing from a stress fracture, what I would suggest is to increase your cadence, and you're going to have to play around with it because different step rates are going to feel better to different people. And then if you're having problems with the calf, what I would suggest is actually slowing down your step rate and having more of a rear foot strike, which relies a little bit less on the calf complex. So hopefully that makes sense. I tried to simplify it there at the end. I realized I was getting a little bit complicated there. But if anyone has any questions, feel free to post them down below, any comments as well. If anyone's dealing with running injuries, we do have a running injury support group on Facebook. Just type into the search bar, running injury support group. We post videos on there every single day dealing with, the different topics with running. Hi, Rick. Nice of you to join me. And so I'm actually finishing up here, but feel free to comment on the replay. My name is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness, and hopefully you found this helpful. Thank you.